Dr. Napolitano, let's talk about cataracts. Even though I've mentioned it a little bit in connection with macular degeneration, let's talk about it in specific, please.
Well, as I was saying before, in the back of the eye, behind the color part of the eye that is called the iris, we have this lens there, okay? This lens works just like a lens you find in cameras that you use to take pictures. It allows us to focus. It allows us to focus at different distances. And this is, just on a side note, it's the same lens that after the age of 40 starts to become a little bit more stiff. So that focusing things up close for some people, many people, becomes hard, so they need reading glasses. That's just a side note. But that's the same lens that eventually becomes a cataract. As the time passed, due to just metabolic changes in our body, just like due to protein breakdown in our body, this lens becomes more cloudy, yellow, okay? And it's a normal aging process, just like getting wrinkles or white hair. There's really nothing we can do to stop it. Obviously, being healthy in general also keeps your eye healthy, and that cataract most likely is going to slow down, but everybody at some point is going to have a cataract. I have patients in their 90s that the cataract is still very small, and I have patients in their early 60s who have already very large, very big cataracts that need to be treated. Okay, as I said, everybody's going to get cataracts at some point. They progress at a different speed for everybody, so there is no set time that I can say, oh, by the time you're 70, you're going to need surgery. It doesn't work like that. It progresses at a very different rate. The sun, the UVs from the sun, once again, tends to accelerate the process a little bit more. So if I do have a patient who has early cataracts, and maybe they're a little bit younger to have cataracts, I do emphasize the need for sunglasses because that slows it down a little bit. Healthy diet, it's definitely going to help. But eventually, the cataracts is going to grow. It's going to bring your vision down. And the best thing to do is to have it removed.
Good. Now, once it's removed, which is not a very extensive and dangerous operation, yes or no?
No, it's not an invasive procedure at all. Usually, in most cases, it takes 15-20 minutes per eye. Patient goes home right after the surgery, and they see better. Many patients see better already by the next day.
Beautiful. Now, how long does it last? And can it be, or sometimes does it have to be redone? Does it last 20 years, but if I'm only 40, at 60 I have it again, something like that? Shed some light on that situation.
Once you have the surgery, that lasts for a lifetime. Some people do develop what's called a secondary cataract, but the secondary cataract is taken care of with an in-office laser procedure. It's very quick, just a few minutes. It's done, and vision is, goes back to normal. So once you have that surgery, it's not like in 5 years you're going to have another cataract. No, once that implant is there, it's there for good. You don't need any more surgeries, until the day you die eventually. It just stays with you.
I see. So you're actually putting something in it rather than only taking out. I was under the impression you only take out that yellowish film and kind of like clean the window, but no, that's not the case. You're actually putting something in.
Right. You take out that cataract, that yellow lens, and we put in a artificial lens, an implant, that also allows you to see. And sometimes what we're able to do is, if you wear glasses before the surgery, many times we're able to compensate for that eyeglass prescription and include it in that implant that they put inside the eye when they take out the cataract. Many people afterwards don't even need eyeglasses anymore. Okay, now it's different than LASIK surgery. That's not the same as LASIK surgery.
I got it. So, however, some modification could be done there, regardless whether you are farsighted, nearsighted, or need reading glasses. It could potentially maybe be adjusted and you don't need the glasses anymore.
Correct. Not all the time. Not all the time, but many times we're able to do that.
Great. So now, once you have this surgery, there's an implant that you need to have special care now with your glasses? Let's say you cannot go into the shower anymore, you cannot swim, or something like that, or not really, just out there.
No, the healing, for on average, the healing process takes about 2 to 3 weeks for the eye to heal. We do prescribe, anti-inflammatory afterwards, antibiotics to prevent any infection, any possible infection, although they're very rare with cataract surgery. But after that, once the eye heals, you can resume everything. You can do everything you love to do, swimming, skiing, whatever it might be. There is no limitation to the way you use your eye. Let's put it that way.
And the world looks brighter again.
Correct. Much brighter.
Beautiful. Thank you very much, Dr. Napolitano.
You're welcome.